Correcting problematic transportation systems is key to improving overall public health, and the U.S. Department of Transportation is taking steps to do just that. Veronica McBeth from DOT is here now to explain. Welcome. Thank you so much for being here.
Thank you. Thank you for having me.
So talk to us, first off, why is the U.S. Department of Transportation here at APHA's annual meeting?
Well, we're here because there is definitely a sync between transportation and public health. You can't really have one without the other. The goal is with public health components within transportation, is making things more accessible, sustainable, recognizing climate issues, and also making sure people who are in disparate populations have access to the health care they need to get to work and the places they play. So that's why it's really important that we're here.
And so a lot of people don't think of public health and transportation together, but what you just said, again, tell us again why it's so important really to talk about this now.
It's important to talk about it now, and it's always been important. I think with the Biden-Harris administration, they have really tried to prioritize the connectivity between climate, sustainability, public health, and then more traditionally taking a look at the equity components. And equity and environmental justice, as we know, are really critical parts within the public health community, and it kind of marries all these things together. So in taking a look at those things, as far as the public health components in correlation to transportation, it's an equity issue too, making sure that we're righting the wrongs of the past where we have historically built infrastructure in Black and brown neighborhoods that have increased pollutants, where subsequently it has caused people to have health implications. And now we're taking a look at how do we fix these issues. We have some amazing discretionary grant programs that help address these very issues, whether it's the planning components or the capital actual building components to help address equity issues that subsequently also connect to public health implications.
Okay, and talk to us about the Bipartisan Infrastructure Law.
The Bipartisan Infrastructure Law is the largest infrastructure law that has been put into place, around $550 billion explicitly dedicated to deal with infrastructure issues, railways, airports, actual ports for shipping issues, also transit, railways, commuter rail, every entity within transit, it's available to assist in. So the funding includes, which is formulary funding, which is money that's allocated to states each year based on formula programs. We have a Reconnecting Communities and Neighborhoods grant that recently just closed in September, but we will have another cycle in the spring. One of the critical parts that we made sure of in taking a look at these grants are making sure they address what we call Justice 40 initiatives. And Justice 40 is a really critical component of the Biden-Harris administration, talking about and taking a look at infrastructure fails, transit and fails, and then taking a look and how do you spin this into a positive category, right? So making sure that at least 40% of applications and funding is directly going to impacted and disparate communities. And subsequently, these are also the same communities that do have high public health impacts. Going back to the Reconnecting Communities program, this is about fixing infrastructure issues that have systemically divided or were just dealt with through systemic racism and issues like that. And so addressing those issues, perhaps tearing down a highway that went to nowhere, that separated a neighborhood that now people can get to fresh food and grocers, so you don't have the impacts of being in food deserts. These folks have access to get to medical appointments and all the things that you would want in a public health and equitable component that does overlap and correlate with transportation.
And you spoke about the grants and funds. They're really helping local communities too.
Absolutely. So lots of this funding is great for states, but also really helpful with local communities, MPOs, some even public health organizations can partner with state and local governments to even apply for some of the discretionary funding. We have a program called Safe Streets for All, and public health organizations can actually apply for funding for those. We have Vision Zero, where we're looking to make sure that there are zero deaths. And that's a process that goes through PHMSA, which is one of our programs here. And we're actually here at the conference, so you can check out their table. But the goal is to make sure that there are zero deaths from transportation or car incidents. So lots of funding opportunities, lots of desire to play well and interact with other agencies, specifically public health organizations, because we know how critical it is.
Well, thank you so much for being here and for talking to us about the importance of transportation and public health working together.
Thank you.